So today I wanted to give you plenty of time to take the lower extremity test. That is now live. You're going to get 2 chances to take that little guy. I would, if it were me, if I was taking this test, I would go ahead and look at the Quizlet for a little bit. You should have been prepared before now, so I'm not including that in like our time frame for today. But make sure you go over the content, feel pretty confident in it. There are notes online, there's a Quizlet, go through the material. And again, you get 2 chances. So the first one will tell you which ones you got wrong, but it won't tell you the right answers. So kind of keep that in mind and be strategic about your test taking online, because this is going to be the easiest it ever gets in this class, because life's hard right now. So that's how we're going to deal with it. But we're going to get into some big oofs today, and I'm only going to go into about 5 minutes worth, because I don't want to take too much of your time on new content when you need to wrap up old content. So we'll do maybe 5-minute video today, and then we'll wrap this one up the next time. Okay, so let's get into some big oofs. PG-13 content today, sorry. So here we go. Click. Okay, so what I have here is, I believe this goes to Bananagrams. I found this bag of letters, and I was like, haha, this is how we can start to go over vocabulary. So I'm just going to draw out a letter, and whatever one comes closest, we're going to go there. It's a V. Viewmont Vikings, look at what I found. And there are V words, so we're going to go ahead to the very first V word, and that is valgus. So this is one where we talked about this in the lower extremity unit and the unit that you're about to test on. And basically what we're doing, we're going to see a deviation that goes toward the midline. So you can see in the picture, not so comfortable stance. You can kind of see it's off at the knee, it's off at the foot. She's very flat-footed in this case. But that is a valgus force when the knee comes toward the midline. So remember valgum, there's gum in the middle of the knees. Okay, watch this. This is going to go right back to the PowerPoint. And we've highlighted valgus. Okay, so second one. Okay, the letter is D. D. Or D. Okay, so we're going to go with the first D word is diagnosis. So here's the diagnosis. It's the name of the disease or condition a person is believed to have. So an example of a diagnosis would be if you go to the doctor with flu-like symptoms, and they do a test and stick some swab, like clean up your nose, like touches your brain a little bit, then you might have coronavirus. And if you do, the diagnosis would be coronavirus. So that would be the condition that many people are having right now. Yikes. Okay, that's number 2. So next, my bag of letters. And in we go. Is R for roadhouse. Roadhouse. And let's go range of motion. Okay, range of motion. So we use, did we ever get to use the goniometers yet? I don't even know. But this little circle-y thing is goniometer. I hope that we've at least touched them once. I feel like we did one time. Hopefully that's not from like last year. But that little picture that you're seeing that I keep pointing at in the wrong way is a goniometer, and it's a tool that measures range of motion. So you can see like it moves in a circle, and you can actually change the arms so they kind of spread out, and you can get what you expect. So for example, we could measure this range of motion. We could go like, what kind of flexion at the MP joint would we get? And we could measure that with this tool, the goniometer. Okay, so back to our words. Okay, into our letters. So I'm gonna get a go on this one's a go, I can feel it. Such a good one. R. Roadhouse again. There's lots of R's in here, yes. Okay, so we're gonna go, there's another R word. We'll go reduction. So this is when you put you basically position it back in the normal position. So most of the time when we do like reduction, or if we ever would do a reduction if we're not actually certified to do this, is let's say that our phalanges, so here's our proximal phalanx, middle phalanx, distal phalanx. Let's say that this middle phalanx stacks on top of this proximal phalanx and it's just out of position. So a doctor could actually x-ray it, and they would want to because they want to make sure it's not broken, and you don't want to be pulling on something that's broken. They'll x-ray it and say, oh, like the bones are just stacked, and then they'll do a reduction and just put it back in the normal position. So it'll be a pull your finger kind of trick. Okay, back to the words. Here's like ours. This is a bag of ours. We're gonna see if it's a bag of. Here it comes. M. The letter M. So this is the mechanism of injury is where we're gonna go next, and we're gonna end this video with this one. Oh, so sorry. I gave you the ugly one here. So this is just showing you some different mechanisms of injury, but essentially when you put together a SOAP note, if you remember, we have the subjective part, the objective part, the assessment, and the plan. The mechanism of injury essentially is going to be the SO, I guess, mainly the S. What happened? The mechanism of injury is, okay, you sustain some kind of an injury. So this disgusting picture with essentially the skin coming off from a ring. This can happen, and I've seen it happen when a kid went to dunk and he had a ring on this like shortened basketball hoop, caught his finger, and then the ring just whoosh, takes everything with it. So muscle tissue, skin tissue, it's an avulsion. It's a ring avulsion to be specific. So that's what that one is. The mechanism of injury could be like, I'm dunking on a 6-foot rim. Ouchie, dang it. So, and then the other one is showing you like, what are you even doing? I don't even know. She's wiggling the wrong way for sure, but she's got some valgus forces with some rotation of the tibia, and ultimately because she planted and twisted, then she ended up with the problem with her ACL. So that's mechanism of injury. Good luck on the test today, and we'll go through more of these the next time. Guys, as always, know that I miss you. Know that I can't wait for our time together in the classroom again. And please email me with problems, questions, anything I can help you with. And we'll see you next time.